Welcome back. Now, hundreds of senior resident doctors working in Karnataka government-run hospitals and medical colleges have been unpaid for the past 3 months. At least 800 medical graduates who have passed out from the government-run colleges have been put on compulsory COVID duty for a year across rural areas of the state. However, 650 of them claim that they haven't received monthly salaries since September. These COVID warriors say that they are grappling with serious financial crunch. In fact, let's take a look at some of the stories that have been brought to us on this issue. Dr. Salman, who completed his master's from government-run medical college, says he's dependent on his family for his monthly expenses despite holding a job. He alleges that although his colleagues have been demanding their dues, they have only got false assurances in return from the government. Listen in.
We have to take it from families, but there are few unfortunate people whose families were dependent on them. I don't know how they are coping up. And so many people we have some education loans also to repay. So it's become really difficult. So we have approached them many times. They are giving assurances. So we are not sure about that. It's been almost 2.5 to 3 months.
Right, and Mirror now exclusively spoke to Karnataka Health Minister Dr. Sudhakar K on the plight of resident doctors. He said that they were unpaid due to technical issues and that all pending dues will be cleared by next week. Listen in.
There are some technical, issues where from the past couple of months, those respective institutions, medical institutions, they are supposed to pay their salaries. And since we are in the fourth leg, that is the fourth quarter of the financial year, the finance department has taken a week's time to clear all these dues. But before that, I have requested all my directors, since all my medical colleges in the state, government medical colleges or independent autonomous bodies. So I requested all the directors to immediately release their salaries, and later we can seek help from the finance department.
Okay. So they say
even our principal secretary also has spoken regarding this yesterday. He has assured me by next week everything will be sorted out. They need not be perturbed or paranoid with the delay in 1 month or 1.5 months. Their entire salaries will be released in full, and from next month I will ensure that on particular date they will receive every month.
I'm joined by my colleague Neha Hebbale on this. Neha, what we can see is that the government's, of course, saying that there's some sort of a technical glitch due to which the doctors were not paid for 3 months, that it was not intentional. But the doctors are, on the other hand, saying that despite the fact that they brought this to the government's notice several times around, not much has been done since then.
Well, Tanuma, that's absolutely right. It's really most unfortunate that, while we talk about caring for our healthcare workers and ensuring their safety also and empowering them, here in the state of Karnataka, the government has just left them neglected and, left them to quite literally fend for themselves. Now, we're not really talking about any special stipend or any other perks, but just the bare minimum salary that these resident doctors are supposed to be receiving as their duty, in fact, that they have been discharging. Now, more importantly, let's understand that, all of these senior residents have, in fact, signed a 1-year bond that mandates that, they will be in government service, either in district, taluk hospitals, or for that matter, even in government college attached hospitals. So, having said that, we're really looking at about 60,000 per student for the past 3 months. That's nearly about 2 lakhs per student that the government has not paid yet. And even while we're saying this, several of these doctors today have tested positive for COVID themselves. Now, their treatment, all of this, of course, at the end of the day does come, with a price. And this is something that the doctors are now having to, borrow from their families again. For many of these doctors, Tanuma, like you heard Dr. Salman, for many of these doctors, they are dependent on this salary. That's their only source of income. And now without that, it's, it's turning out to be really grave for them. So we'll have to wait and see. The government has been assuring them, for months now that they will actually pay out these salaries. But we'll really have to wait and see how long it takes for the government to wake up and realize that, if these doctors today put their foot down and, they stop discharging their duties, it could be a very, very grave situation over here in Karnataka.
That's right, something that the Karnataka government should take notice of as soon as possible. Neha, thank you so much for joining us with that.